AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach, Broward, and Miami. You can reach us directly, 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. This evening we have Ed Salazar, who is the Director of Pulmonary Hygiene right here with All County. And thank you so much for coming back on the show, Ed.
It's always a pleasure.
Absolutely. We always love to learn more about, there's just so much to learn about what you do and how many people you're impacting in the world. So we always love to have you on to learn about that.
Thank you.
Yeah. So how long have you been with All County?
Well, I don't remember exactly when I started working, but I do remember exactly when we started the pulmonary hygiene program.
Okay. When was that?
That was in December of 2011.
Okay.
So it's been quite a while.
Yeah. So last time you were here, you did mention, and I learned that All County is the only home health care agency that provides IPV therapy out to the community. So maybe you could, in the state of Florida, right?
In the
whole
state of Florida,
yes.
Mm-hmm.
So maybe you can share with us a little bit more for people that are listening for the first time. What is IPV therapy?
IPV therapy, it stands for intrapulmonary percussive ventilation. Mm-hmm. And it's a way, viewers out there who have raised children, and if your child ever had a croupy cough you ever had congestion and you were told to clap on their back.
Oh, that's right.
Okay, well, that type of therapy, it's called chest physiotherapy, and it's still used very commonly with children and with people with severe congestive issues. Mm-hmm. Mostly COPD, but cystic fibrosis, bronchiectasis, things like that. Mm-hmm. And what IPV does is it provides that same percussive effect, but it does it internally rather than externally. So
how is that so? Can you explain how that works? Is it a device that goes over the mouth?
Well, it's a nebulizer.
Okay.
And the nebulizer has a cylinder in it that has a spring-loaded piston.
Okay.
And a pressure is applied to that spring-loaded piston, and it's going to oscillate back and forth. And there's a little opening to the port where the aerosol is generated. Mm-hmm. So this sliding action develops, it uses the Venturi principle for air entrainment and bringing up the aerosol, and then it pulsates the aerosolized air into the lungs. Now the beauty of it is it's done at very, very low pressure. There's absolutely zero chance. It's called barotrauma. There's zero chance that the pressure can cause any barotrauma to the lung.
Good to know.
Good to know, right? It's used on neonates.
Oh.
All the way through, much elderly people. The young man that's in the commercials all the time for the Children's Hospital, he says he has osteogenesis imperfecta. His bones have been broken over 100 times, remember?
Yes.
Well, kids like that, when they get congested, you're not going to want to do that.
Absolutely, right.
And children like that frequently are treated with this IPV because all they do is they breathe just like they were breathing with a regular nebulizer. Mm-hmm. But they're getting that gentle percussion into their lungs. This is going to mobilize the secretions upward. If they have any lung volume that is collapsed, it'll recruit that collapsed lung volume, mobilize secretions, all is good.
So Ed, I was just thinking, does this have like a compounded effect? In other words, like over time it will benefit the person. Like it's like an increase in breath for them, like over time if you give them a certain amount of sessions, does it compound over time the health benefit?
Sure. It's a cumulative benefit.
Thank you. That's the word. Cumulative benefit. Yeah, because I imagine that you would give them whatever treatment it is, however many sessions. So as they get more sessions, is it maybe more times in between, like the interval is as they get better, maybe they don't have to do it as frequently? And
it all depends on the acuity, Louise. And typically the patients that are referred to us for treatment, they're in a high acuity stage. You know, they're having problems that the doctor's concerned about, and he wants to avoid them having to be hospitalized. So this is an intervention that can be done in their own home, and we can mitigate their problem so that hopefully avoid the trip to the emergency room and an admission. Now, depending on how well they respond, you can decrease the frequency of the treatments. And 80% of the time we get these folks down to what is called, like a maintenance status.
Nice.
PRN.
Nice.
And we will just see them as needed. And how do we know they might need it? While we're seeing them initially, we teach them, the pulse oximeter, measure their blood oxygen. But we also give them a peak flow meter. Just like with asthmatic children, they're trained to blow into this thing, right? Yes. And depending on how hard they can blow, what kind of a flow rate they can generate, is a relative indication of how clear their airways are.
Makes sense.
So these patients learn how to do that. So now if they start feeling a little, short of breath, they're not breathing as deep as they could, or they can feel themselves wheezing, or they start hacking up some purulent secretions, check their saturation, check their peak flow, and we'll give them a target number. Like whatever their best values were. If your values decline by 25%, then contact your doctor.
Right.
And very, very often, he'll just prescribe a recertifications or another bout of our protocol, and we can avoid them exacerbating to the point where they need to be rehospitalized.
So let me see if I get this straight. So let's say a person who is on oxygen, right? They need their oxygen. They're getting their oxygen, but it doesn't necessarily, it sounds like IPV therapy is actually helping the lungs, whereas oxygen is just, oxygenating you, whereas IPV sounds like it's actually healing that process.
It's a lung conditioning program.
Yeah.
Now, breathing in oxygen will help increase the amount of oxygen being delivered to the tissues.
Okay.
But it won't necessarily reduce the work of breathing.
Right.
And it won't necessarily help you clear secretions.
Right.
And those are the problems that lead to the more severe complications. There's I was just
I was going to ask you to share that with us, because I want to talk about
this morning.
Yes.
I was studying for my recertification exam, and I came across this. This is a study, hot off the press, and it's from a publication, the health edition of the Epoch Times, a publication I highly recommend. And it says lung function peaks earlier than previously believed. Now, what that means is from the time you're born until the time you pass, there's a point where your lungs have reached their maximum peak efficiency. And it turns out that point is a lot earlier in life
than we thought.
Than we thought, yeah.
Wow.
And this study concluded that for males it's 23 to 25.
Wow.
And for females it's even earlier. Now once once you reach that point where you have your peak lung efficiency, every year thereafter, as a natural process of aging,
Sure.
that capacity might diminish from 10 to 50 milliliters per year. Now that's not a lot of 10 milliliters is not a lot.
Yeah, but years add up and come quickly.
Exactly.
As we know.
As I know, I'm acutely aware of.
So interesting, because I always want to know, Ed, what can we do at home? I always want to bring it to the practicality of it. What can we do to maintain our lung efficiency? I know you mentioned something before about deep breathing.
Deep breathing, a lot of the Oriental arts. We were talking about Tai Chi. Part of Tai Chi and part of meditation techniques. Just the deep breathing. Your airways are coated with smooth muscle, and that's why airways can actually constrict and expand, because they have that muscular tissue. And problems like obviously smoking,
Sure.
but other things, environmental issues, occupational things, a lot of things a person can encounter that will compromise the efficiency of the lung.
Toxins.
Obviously, avoiding those pesticides, eating right.
Yes.
You know,
Always goes back to the basics, right?
Goes back to the basics, exactly. Anything you can do to avoid, harming your lungs, will prevent that process of reducing your lung efficiency.
Right. So what else was on this study that you deemed to be noteworthy?
Well, what I found was...
I think you might have highlighted a few things.
What I found was interesting was, one of the key findings shows that lung capacity develops in two phases: a rapid growth phase in childhood, followed by a slower increase until reaching the peak. For women, the peak occurs around age 20, while men reach their maximum lung capacity around age 23. The decrease per year ranged from 10 to 50 ml per year. And
yeah.
But you can you can always, whatever lung volume you've got left at any stage of your life, you can always do things to try to make it more efficient. Exercising,
Sure.
anything that compels you to deep breathe.
Sure.
All good stuff. But yeah, I'd if anybody's interested, you got our phone numbers. I'd be more than glad to provide this documentation for you.
Anybody wants it, 954-717-7027, and you'll be able to speak to Ed. So who, let's say at All County, can you give us a sample of an idea of how it would work if somebody needed the IPP therapy and somebody were to call in right now? What would that process look like for somebody who's sitting there right now saying, I think my grandmother needs this? What would that look like?
Okay, well, we get the order from the referring physician. The case worker, the case manager, is going to assign a nurse to come out and see that patient. The reason that patient isn't seen by a respiratory therapist, and we'll do a little bit of political lobbying real quick, is that Medicare, in their infinite wisdom, will pay for respiratory therapy services in a hospital, but they do not pay for respiratory therapy services in the home. So that's why when my wife first got the idea, she said, well, could you train nurses to do this? I said, well, of course.
Smart.
Of course we could. So that's how we developed the pulmonary hygiene program. I trained a team of nurses how to safely and effectively administer the therapy. And they'll go out, they take the machine with them to the patient's home. The patient has their own circuit, which it's their responsibility to keep it clean. We teach them how to properly clean the circuit in between treatments. And if there's a particular issue that needs attention, then I will go to the patient's home. But because that can't be billed for, All County eats the cost of my participation.
I see.
And I'm not cheap.
I see. I know you have a lot of years of experience. You've been doing this for a long time, so we're lucky to have that experience.
Well, the fact that all county is willing to absorb that expense to provide the therapy.
That speaks volumes,
Yes, it does.
actually, because what they're really looking at is the best interest of the patient.
When we
I like
first
that.
when we first set this program up, or when we first proposed it, Mr. Biazzi, he's looked at my wife and he says, "Well, can we make any money doing this?" I don't know. He says, "Will it help our patients?" And I said, "It would definitely will help this certain cohort of patients, without a doubt." He says, "Okay, well, let's try it." And it went from there. And now, all county, I believe they have 5 machines.
Nice.
Mm-hmm.
That's amazing. So let's go over again who qualifies for this. People who have...
Anybody with any kind of a chronic lung condition where they have an ineffective cough or ineffective airway clearance, because the majority of times that's what results in the exacerbation that requires them to go to the hospital. Now, most commonly in the adult population, you think about COPD,
Right.
chronic obstructive pulmonary disease. But it could also be a neuromuscular problem. You know, somebody with Duchenne's muscular dystrophy, for instance, they get to the point where they're starting to lose the ability to take deep breaths.
I see.
You know, we've had patients. Probably the 2 most celebrated cases that we've had. We had one elderly lady who she had advanced COPD, and hers was a combination of emphysema and bronchitis. So
Oh,
she
wow.
had a lot of congestion.
Oh, yeah.
And her only desire was she wanted to see her granddaughter get married. So the doctor, he and Lou were personal friends, and Mr. Biazzi, and they called and we set the lady up on treatments, and we treated her for a couple of weeks. She started feeling much better. She went back into the pulmonologist's office, and they did a chest x-ray, and the pulmonologist said, you've mixed up these, this can't be the same.
Wow.
He was so impressed with the improvement in her chest x-ray, and her exercise tolerance improved. Not only did she attend that wedding, she danced at that wedding.
That's amazing. I love to hear these stories.
We had another elderly man who had been on a motorcycle, and he was run off the road and went right into a brick wall.
Oh.
He had a very severe chest injury, contusion to the lungs, and he was in a subacute facility on a ventilator for a couple months. They weren't able to wean him off.
Wow.
We went in and we introduced that facility to IPV therapy.
Nice.
And they not only weaned him off the ventilator, but he was discharged off a ventilator. And then we followed him at home with follow-up IPV therapy.
That's amazing.
And he never required rehospitalization.
I love these stories. We have a quick commercial break. We'll be right back, everybody. Stay tuned.
And we start there. That is 20.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, Call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in, everybody. Ed, we actually only have like a minute left, so if you could share with us in this last minute, what's new with All County and what can you tell us?
Well, as you know, we're a tri-county agency, and we're just strictly a Medicare, conventional Medicare. But we are investigating relationships that we might be able to develop so that we can now perhaps work with Medicare Advantage plans. And that would greatly expand our outreach and the populations we can serve. And we also have a staffing agency, American Staffing.
Yeah.
And that's a registry to provide aides, nurses, and it can help with all sorts of palliative care, things like that.
So I'm going to give the number out, 561-272-3300 for the staffing agency. Thank you, everybody. We're out. Have a good evening.